National Health Insurance Authority at NASE, Dr. Aboagye DACOSTA Abekansa ewe in studio. I'm going to that in our earlier conversation. But we are turning our focus onto the National Health Insurance Authority or more National Health Insurance Scheme, and they have other functions as an authority. You be free corona you didn't and come doc. Akwa baby on say
yeah, onuya nyame adom me ho ye pa na wo ye
onuya adumia bibia boko
nyame adom bibia boko
health insurance boko.
Oh yes, health insurance EKOSIISEN bibia boko.
Yeah, da nyame ase. It is you've been CEO for how many months? Bear saying
about 3 to 4 months.
Oh, about 3 to 4 months. It is still a honeymoon no goes wrong.
Honeymoon.
Okay, take ground running.
Straight away.
Wow.
And
wow.
Yes, me buy and I start my
yeah. In the role as what you were doing at Ghana Health Service at the time. Now you're in charge of health promotions.
Yes.
Aboa in letting you settle in our NHIA
obi me da say me ka say mbo idea na me boa pa e na say COVID so buy no
yeah
as na me lead aspect of the COVID and say ni nyina building on my experience in terms of, in fact, insurance in the no I'm school okay. Me a PhD in the National Health Insurance Scheme, researching in the National Health Insurance Scheme in Ghana. Into my main expertise.
Oh, okay.
Health promotion, then I master's.
And master's degree. Public health and health promotion.
Yes, public health and health promotion.
Okay. Oh, that's interesting.
Yes.
For what you did on health insurance, no, and PhD.
Yes, PhD.
Apart from so, you're a medical doctor. You're a medical doctor too.
Oh,
you're not a medical doctor.
So my background is pharmacy technologist, which is pharmacy technician.
Okay.
Then in the UK, I did what we call medicines management. So in the UK, if you're a pharmacy technician, you can specialize as well, so that you be in consulting room with doctors, advising on contraindications and. So I did medicines management.
Okay.
Registered with the General Pharmaceutical Council to practice the medicines management.
Oh, okay.
So I was always in the consulting room with doctors. Going for ward rounds, advising on patients' medications and all those things.
And from that now, acquire masters in public health and health promotions.
Yes, in fact, whilst I was doing my masters, that was what I was doing. Because I'm rotated. So
yeah,
school.
Me
me masters no ansana me
PhD no. Oh, okay. But you know, so I've always thought so we're medical doctor.
Medical doctor.
Oh, wow.
Yes.
Wow, that's nice. Congratulations.
Yeah,
thank you. To get a PhD is not easy. Yeah. Why are there? Wow. Into at the National Health Insurance, who take it over and now top 3 priority areas our insurance one year day.
In fact, me da say Obi. In fact, now top 4.
Top 4. Okay.
So me starting and no who say obviously Obi a expertise there. We training and now we gaps and kakra there. But let me at this point praise my predecessors. They did a fantastic job. Honorable Okobo, a solid guy. Dr. Selby, another solid woman who obviously did very well. Dr. Ano, time now me suya de ni na Dr. Ano mu se omu nyina me kostra o mo time na me o hono me Dr. Selby mu nyina di nkuta ho na honorable Okoso de no eminua amene no bibia. Nti all those experiences na many okuna serve or COVID task force
no social
now me start and who say there are a number of things I bit me immediately because be our PhD then you know the acts, you know how I work. So the first thing I na me nka se me na me buy but na me gidi says ye shemu kena ebeboa formalization of the system.
Okay.
Again, anchored on digitalization. Now, baby aye kona. You say National Health Insurance number no. Yeah. Say your Ghana card.
Okay.
Number.
Ghana card number should be your NHIS number.
Exactly.
Okay.
Into na menuya honorable Okoboy. No more started that. No more integration into Osha so dial star 92#9.
Yeah, ultimately renew.
Ultimately, not even the renewal. Ultimately,
integration
with NIA.
Okay.
Because unse a buy a link databases no NIA, SNIT, and
Yeah.
into ultimately wing. Now, you share a database, so you who say 6.3 million young people between the ages of 6 and 14. Almost all database neswa omuni Ghana card. At the end of the day, the major aim is what? Universal health coverage. And on him say, yeah, act no, say, as you cover Ghana Nibia, and basically mandatory for Ghana Nibia
to be on the scheme.
The scheme.
Okay.
But okay, a database now 28 million subscribers. Only 17.8 million as of 2023 December in an air active.
Okay.
So oti free more on difference. No?
Yeah.
A bit more expired cards anyway.
Yeah.
So how do we now formalize the system in such a way that Ghana Nibia benya access? In fact, our mechanic say insurance scheme no the no it provides an anchor for Ghana to achieving universal health coverage.
Okay.
And I'm going to explain.
Okay.
So to say the American between 6 and 14 years, near was 6.3 million of them are more database so our money card. And sika ye call parliament, ye costre no. The nanki de be ye yankasa NHIS card no. Yes there be. Ye de be ma NIA. Na NIA any yen e de Ghana card.
Okay.
And once our BSA no, now you are covering 6 to 14, 15 and above.
Yeah.
Almost over.
Yeah.
Ghana Health Service 0 to 5. Until you have covered the whole population. By giving them what? Access, because your NHIS number is your Ghana card number. So
yeah.
And you see, so now in universal health coverage, so affordability is key.
Sure.
Now, because we cover 95% of diseases, there are some barriers that we have to obviously deal with.
Yes.
And also, you are starting pilots as a CAA. So, you are SNIT contributor as a CAA. Already, what we are NHIS,
Premium,
no. What we are, there be premium, NHIL,
Yeah,
levy,
Okay.
End up your way I can say your salary payment, your pension, what you are through your pay.
Yes.
So it's about 2.5% from SNIT.
Okay.
It is always a SNIT contributor. Why the what you are So there was no need for us to say what you are that need here. So you are ACDs because that was a barrier.
Yeah.
So board any buying decided said there be ACDs no yen free or near automatic onboarding.
Okay.
Because at the end of the day, say Ghana card ne pay way mount. Emma be your NHIS number. And say you onboard you automatically. Nature so we a member.
Sure.
Now what this means, they say, in fact, yen we private sector now. We say normally cry no. Omo airco we are your friend says. Omo call normally no so omo kwa insurance. Your friend say not very expensive.
Yes.
But because we cover 95%, now you need a regulatory way for your friend is saying you need a regulatory private health insurance for no. Now your insurance will be cheaper because you only be taking the 5% I am cover no. Because we formalize the system. We cover 95%. Any regulatory private way saying. So I didn't know I 95 ni BM. So now the only here then the 5% no. Now all the abedin, now the abeka home. On the benefit of digitalization. And the American say once we are able to formalize that system, so Ghana Health Service a number at birth no, and a you say you best send your text message. Now when your number. And by that alone, that by this single policy in Nkwano, universal health coverage has been achieved. Yes. So it's just a simple strategy. But again, you see, there are other things that say nkakra. You started pilots, no. Yeah, hopisa students in BBA school. Now, His Excellency Dr. Alhaji Muhammad Bawumia, the Okofa Digitalization by Ghana. So Ghana was in digital darkness for 60 years. Yes, for 60 years we have been in digital darkness. And then abrochra ye can be digitalization. Enti once a bit me achieve we say no na onua universal health coverage ye can you know I say achieve into obelanche enche nkola no amakwan de ye de ya start in fact obayen NHIS offices kra na obe won say ye NIA for no ye wo ho ye den
for 15 to 24 for
no,
from card no
6 to 14
for
me no NHIS office yeah because any NIA for no air collaboration into your machines thing in a office
in your card or the Ghana card
in fact me will be crash me we say more me will sample me we say more meet me at the Ghana card me deputy are joining me into my work coming on to be view or no so bet me
remember na
Kwame, so that is the first we say no. Now that was the first initiative they about on board. The second one co-payments no. I mean sorry, Obi. Co-payment now has become a very big issue. In fact, every time the insurance no, you be increase tariffs ni bia no, facilities ne say oh there be a drone bi ni ho. And I say drone prices no e cost so me approach ne say yen solving no once and for all. And yen solving it once and for all no, how do we solve it? Now, you share facilities no. Almost say in our providers almost say Kwame sorry Obi almost say we a friend is saying tariffs no then iswa and you say okay act no am I a client say just once a year review and to say yamfa bibimbra your friend automatic price adjustments automatic price adjustment that to say the fuel petrol the no one of the economic models also in insurance that you can use and no you be nya the friend National Tariff Review Committee and the na prices be cost no that's our tariff review committee no I then a review no more the appropriate prices aba buying ebe set prices no for pharmaceutical companies because price regulation is very important in any way economy no you have to be doing that so once I buy ebe no we know the prices already the National Tariff Review Committee will actually be working and to say omo juma ne say yes say paracetamol ebia cost kakra and one say okay yes we insure any 20 yes say you be cover no budget ne mu by a percentage say the prices ne cost then you betua next year massa facilities ne pharma companies that guarantee now hospitals no they will have no moral right to actually charge our client because at the end of the day we are giving them what it is. Kwame Mamemfa Obi Mamemfa we say impem. You see the woman say 2016 ye buy no na a care that way 1 year. The entire facilities ne ka 1 year. And na me no ka say that so die nya.
Omo claims no.
Omo claims no a care that ho ekufo ado ne ba omi aban. And then me no can say lower tier facilities no omo forming 80% of our providers yendi omuka because
they are up to date
me say kwam yendi omuka and I'm going to explain me best in fact the last one I able to me table so say here now mama chechro mu yendi omo contract say insurance no work on claims purposes for claims no say we wi answer no abeje into your 3 months 3 months period. That's our contractual agreement. So say 3 months there. Say obosume be mu August. It is metimi say metimi atua up to April. Okay, April, May, June, July. Medi omuka.
No.
Exactly. So you see where because at each particular point you be omuka 3 months. And no ye any omu contract no ye any omuka. In fact, I'm here to pay April. Because many controller di nkomo na unsa won ho ya na ye betua salaries ya na pressures dey wom and they say ya agree say on be my scan in the first week of every way no
month.
Every month and no relieve omo from pressure me no cause omo the scanner dey aman ye betua in fact and then watch na I'm sure say it will just go ye ne facilities for nso dey akasa mo mai dey omate ase so abaya na ono de ka 1 year 1 year on tuaye any abaya on the facilities neka you advise all the 3 months which is within the agreeable way no wetua sa aban no any way no you get where I'm going.
But then I'll say low tier facilities.
Low tier, so
okay,
I know chips, small health centers. But now let's come to the higher tier facilities. Higher tier facilities, you almost 1 month. You try up to February, and no crying. You try to bridge the gap. This month, control Abema is coming bridge a gap. No. You see, you have a bridge gap.
Higher tier and hospitals, and
the tertiary facilities, the private facilities, and all those big ones. No, yeah, you almost 1 month. So what I say. So, as you putting it into contest, digitalization. I mean, we can once a month. The entire NDC for one to claims they were normally procurement. Instead of the hospitals, normally procurement. Yeah, but yeah,
procurement of them.
Procurement of I mean obviously when your facilities no when procurement we say no mu tua fast nti buy no o ma tua all procurement contracts nyina claims na so mu tua na the most significant we say no mu tua e no mu tua e kwame
the other thing will be say NTCC no na yenim say I think and the boy or can say or this policy about anytime their facilities are paid, there is this common platform or
exactly. And that's why pass CA sunshine policy platform also like I'm saying, because I've not paid the April one, which it is ready now because of what I've just explained to you, be also and yet to also you're making it public. In fact, as part of the IMF conditions, okay, we are also supposed to even meet some of these obligations. Enti a open document yes would be this year. Someone making you can verify it and meboa because me say meboa. So what I say when you have facilities say omo ye debut.
Not as it used to.
Not as it used to. Oh, and they say no the here say oh yeah this automatic price adjustment we be then ebeba. Na yenya de bawie na facilities no manya hoden say say be insurance they say omo delay in payments biem they say omo tariffs so omo hwehwe no omo de amayen afei kwam your best your best set task force with in fact Ghana Health Service DJ Chuck CEO and the private omo nyina agree say etimi yesa omo be join yen na set task force and no wa obeji sa illegal fees ni nyina wa obeji sa illegal fees no ye be chew onum say aso etimi prosecute there. Your power say to me a prosecutor. In fact, no can say some people cry fraud we say them. We say yen solving the once and for all. Into with and some year McCain with this automatic price adjustment and this national ID. We know me sure say be go a long way. Now me can e-pharmacy so asem. Ebi so our hospital now or see a drone bi ni ho. Nyame adum say me no can say there is light wave. Link all the hospital records no enti CSA link all the hospital records ne dia ya the e-pharmacy be den ebeka ho they say be make sure say hospital bia so I enroll on the e-pharmacy platform enti say me ba na say paracetamol no atwa na so say ebi ni ho me say there be ebi ni ho but the obaye ne say fakọ sa platform ne so o pharmacy fakọ so na hwe ba bia ni pakro no te the catcher say onko ni local pharmacy no nye den obenya bi no onko gi aduro no den ewo ho and there is tracking system ewo ho abetimi atracke because of Dr. Mahamud Baumia property addressing system on the buy enti ye betimi deliver nro no amomo ofie abrote sanete wa me order dry it be deliver ma me ofie eye we mu a enti digitalization Ghana your development is anchored on digitalization. Wow, unjin tumwa obeka so now the year kwechire 60 years. Enti na me catch say Ghana has been in digital darkness for 60 years no. Enuntia. So you see where we are going. So these two things actually will help us to achieve universal health coverage.
My question on the first one, which is say the idea say Ghana card number, besia your NHIS number no. It is here say menya me Ghana card I will not need any NHIS card.
No, there be here.
And no, some person me renew may
That's in fact that's one of the benefits. You see, Ghana card no lasted for 10 years.
Yes.
But now your card no lasted for just between 3 to 5 years.
Okay.
So what is the point of even producing our cards again? Yeah. That's one of the benefits. And Tisa expiry into nam catch say, your sister, you're 28 subscribers. But be bring our cards and we will do this by text message systems. In 1 year system, not send you text message. You are a member already. And just any after 10 years, and also we will renew Ghana card. In fact, Obi, Maminka se me you see, to say the nam here Juma hospital, okay? Say Oba, ne say ukuta o NI card, your ball NI card, your ball BBA, it me who history.
Sure.
Or health history will be here. So with the Ghana card no at the back end, we can have your history. Because of confidentiality, doctors spend a very day.
Yeah.
Sanya ya brochre. Because me say na me doctors na take consulting room. In ye prescribing row, near check contraindications ne way. Sa pepe near then yeah. With a chip ni wom. Udi share mo na nipa chronic history ni bibia then aba. Including baby or tear, baby or koye. So you don't even need say oti hase. Ena baby abeku bia across the country. And our country's development is anchored on digitalization. Now, me say Ghana card holds the key for Ghana achieving the universal health coverage. And makani oma mienu.
It is say me Ghana card na. As long as my Ghana card no active and expire, no, meaning say my NHIS membership no so valid.
Yes,
okay,
valid.
Okay.
Obi mamin card the etosumians.
Yeah, the etosumians.
So on said to say them can background your health promotion prevention and o share me PhD cram here na so promotion prevention no na ka ho pa. Ye na nanu aka kire say prevention is always better than cure. So o share in 20-year history na the promotion prevention aspect na ye no ya na a vertical programs in a Ghana Health Service insurance yen cover that and me no ka say just last week ye launch free annual health check for all Ghanaians.
Free annual health check
for all Ghanaians.
For Ghana Nibia. National Health Insurance launches our program.
Yeah, launches our program. No,
and
Babeche, no matter time we best start, no matter BBA. Okay. Obi, so Oshe and cost drivers. It's as insurance, no sustainability is key. And it's a health economics perspective. And nyoma be na betimi aye na betimi reduce
pressure na
scheme no. The top 2 cost drivers are way scheme so hypertension, diabetes. And the DS kapa
hypertension and diabetes.
Me say I don't know here where you can say and yes sky tuama facilities no be brain na area no. And as a health economist, the first thing you do is how do you tackle that through early detection? And yes, say no Parliament approve scabi my away in budget so SEM financial year. And then me no can say free annual health check no covering diabetes, blood sugar test, blood pressure and all why I say we na who de den ekunipa even dialysis cry ye kan ni nyina wo linkage wo hypertension when so enti de ye ne say you say eda ye wo NHIS be send o text message say for facility B wo local area ye ya credential okwa ye be hwew na ya check wa pomuden
on be check up amount
aye den amount na say ebia uwo diabetes ne hypertension na NHIS cover that into you be treat you but so borderline na your friend be yellow you do better yellow no near monitor in fact you Ghana Health Service na be into say so mo extra wo fie kra no mo check him out consistently on be den on be am because almost so ye be friend wellness clinics now say wo your friend is saying who green there and they just say afesa say no I dey wa ba
wasan akwa ye bi
e be ya ma ye nie e be ma Ghana fo anyina che life expectancy be den e be increase because at the end of the day you are now detecting the diseases early. Your cost burden, your cost drivers never then perform. It's a bema insurance na then I sustainable over a long time. It's a bema pressure na was na then aba e betimi kra me cover yare bebre rather than say yeah we can say yes spend this cano ewo we no. It is our preventive healthcare no e hu hia pass.
And you see as part of this policy no, the NHIA can say Ghana Nibia on with date of birth no.
Yes.
Utimi Bora hospital be a NHIS. Ewo my credentials are hospital or my service provider mamu metimi akọ
ubeti ya best test message so you because you link it again Ghana card,
yes,
and because you link it databases into you the details your numbers so you will get a test and a code code now the qua and we will deploy AI technology it is our code now the qua you be who say would some month when you're there because bear in mind it will cover only people within a specific month. Sure. It's easy to do. Now, what they are no qua such as say Ghana Health Service say they will deliver the service through what we call the wellness clinics. Into the only can prepare baby. Charge for also say almost why then charge a Christian Health Association almost why you're ready. In fact, weekend way almost launch one wellness clinic Agogo Hospital. Me bo mabaso. Private health facility for no. Almost say almost the idea kra mu ye kra no ye bi dada. Enti ye nyina be bo enti when ye joint implementation enti ye say way. So they see and I cut some loose ends kitwe bi near there.
And I me kwana me koye sa test na. On my birthday I must send me message ama me code no. Me kwa mintua hwe insurance be cover test na me
because no insurance e boa yen because to say the much on e be boa yen. In fact it will also help us to achieve the sustainable development goals. Now let me explain. Goal 3 of the sustainable development goals talks about health and wellness. It will cover the wellness aspect of the goal 3. Universal health coverage is what prevention promotive is one of the pillars. Now, Kwame, the significance of all this, ASA, non-communicable diseases. Edienya enti ebe boayen amia eden tackle non-communicable diseases.
Because at least through that, and Ghana phone be brina no say and Ubusan said the last time I wear a test, dabenya. Baby nampon kai last time I call a test into
brantie be a friend kaba me PhD the metianes brantie no cardiac arrest sa nyoma ni nyina ye we mu nyina e be den in fact abrochire ube said defibrillators nice see abonte anyway. These are the strategies omo heden omo dey atutu akwan mu enti omo nim say at each point no they are prevention measures.
Into the service provided more facilities are be on board this health check no. Omono no will submit claims number 2.
They will submit claims near to ya.
Okay. Say be a nipa buy ya test your money.
Say ye be records so this time no for fraud purposes nti ye initiative process na more. So we will know nipa krona why the wa but he is coming with a code.
A code. Okay.
So almost said that so he is coming with a code. To the background code who use code now there is a system. Because your verification systems or hospitals now, and you see a pilot here, a baby rule. We say, it's your away system to say, oh no, we will use code no. And see, the claims are automatic. You know exactly what you are paying for.
Oh, okay.
Oh, until we know any fraud in your man anyway. And now see a bit deploy AI so to make sure say we know.
That's the third focus area. Focus number 4
Me number 4 no. Asemo ho kakra.
Okay.
But me cheche mo kakra na ma pause say a work in progress. Obi number 4 no de tie nie. Ohwe yen acts ni mo a. A mandate as a cover non-Ghanaians.
Okay.
Now say obi buy en kroim. And Kwame me ne Professor Zakaria that ambulance sure. You see, Omo apiki cases a obi ba ye kuro mu keke ebesrae oko ahanen cry wenya accident oko hospital because A&E is supposed to be free oko a onya den because only cover bia nti na kanaba beto aban so se obi ba ye kuro mu no kutayare a kwame by a public health act no a binary responsibility say enti say side of the act no ya activity na national health insurance provide insurance my visitors na eba kro mu but minim say na say abey topical e wa ha say but me approach ni let's seek advice from the attorney general ye we attorney general ho na enfanko parliament niema amanfo no so say cabinet and have your must say now as a country no
you take a decision
the media me say the mimisua na yemi expertise na the ebeboa because at the end of the day any country that do not rely on its diaspora or her diaspora for resources no is doomed.
And based on our expertise no what do you reckon should be the position say obi a foreigner Onya Ragana there should be a system on also bit contribute to insurance and
also you bet me cover cover through the insurance. So nipa kro no one insurance yemfa some exemption criteria enya den embra. So nipa kro no one insurance don't worry just validate the insurance asem to nipa kro na onkoje we say but omo bana asem to omo no insurance there yen designated facilities nya den ema omo ne enya den yem omo nkosa facilities
na yen show omo for free.
Of course, they metuya. So insurance, so they pay through the insurance package. So just say a for free. In fact, you see that's the concept of insurance. But maybe main way saying is it will bring in more funds for the NHIA. Because at the end of the day, people talk about diaspora funds. Go to other countries and see. The CIA say dialysis. Okay, dialysis. Unim say NHIS cover acute kidney disease. Country beer sanomu cover. The acute form of cover by a croimu dialysis be who
major issue
a major issue no again abaya or hun crofo mobo or say there be yenhwe amobrohu for nkola enempani entibe no ka say omomadi mfie 18 and below no free omomadi 60
and above no
free in between no aban say there be met me subsidize say me subsidize no ma hwe say bia met me atoto machines bia ma hospitals na bia 2025 nyame ya dom na say Dr. Bawumia ba o say there be meto facilities na say me the different form of we comprehensive plan bi be den ebeba na ye den etimi abeboa ye nuamu awo dialysis so
baba no as the CEO no are you not worried sir because one thing about providing the means to pay for care no for 18 below 60 and above when you have renal units no shutting down so now and fast will be
you see enra me ne kolebu for no meeting
okay
assembly see kolebu it has nothing to do with sika sem it has nothing to do with sika sem there consumables no in omo cry no I think say a bedroom pot no unsa ekrom okaya HIV in roni bi a bedroom pot no na aseme den e baaye so clearing process no ese den ye hwemu ye in fact omu yusu ekra ma honorable Dr. Bernardo Koboy ekoboro consumables ni bi wo ba bi ye den e de ma omu e ma no so san yet na omu ntimi clear sa enioma no me no ka say NHIS your promise I make ye tua in fact to the stand cross say say patients omu do omu sketua ye no ye refund this kind mo mo
promise of taking care of 18 and below
yes
60 and above
yes
and subsidy na wo omo in between
yeah ma omo advance payments
motua
yeah be see omo the advance payments kwame
and then renal unit bia motua for renal unit
yeah be say facilities na ye we no your mom so the like I'm saying insurance concept no we but when your mom almost can cry in advance and yes so enter into the system enter to the system ho tamale anyway you almost come In fact, ebi mo kura se almost can e de mo no ebi ahya de ebi aye den aka a omu gu so omu ye den omu yusuo e de na abanya biem enti mom yen fa ne nyina holistically na yen hwe nhyehyeye a abande ba, and these are reforms that a bit change the health architecture of our country, especially the preventive promotive.
Yeah,
it will change the healthcare because see offer to say the Americano your 20-year history you cover your benefit package then cover preventive promotive after near bed cover, and as we go along we expand. In fact, health systems across the world, they are now tackling what we call determinants of health. And to where oko abroche UK or say 5 a day, fruits, the fruit oko Kigalia tracks near yan wo kwan se muntumrika oko baby Korea anyway obe say gym ewo den ewo park so san your money be in a year den ye hyase eye wa ha say we have to focus our health system on wellness.
Yeah, and nuntinema sa annual health check na critical.
Exactly, very critical.
But beyond that, no, would you also probably push, say, well, and Nancy knows a Ghana for interest in exercise, akosro, in the ahomachin, you see that. But can we have a policy around and also?
Obi, mejitumpa, you see, NHIS, yeah, pay setters. In fact, as we speak now, my mandating all our facilities to have what we call the wellness club. Every week they have to do physical activity. Yeah, officially launched it called Takra, you know.
Okay.
Yeah, you wait every week they have 1 day.
Staff of NHIA.
Staff of NHIA. Every week they have to do at least one. And to once a 1 day be or how measure t-shirt no more no more. You can just find out from them. Now there is excitement within the NHIS, within the staff. You see, because yes, we are more pomodena. Yes, we are pomodena. But me, I'm looking at a day where the president of the republic will announce, say, and that year, National Exercise Day.
Exercise Day.
1 day. I'm looking at a day where the president of the republic will announce, say, and that year, they are two or say Ghana ni be a man when meatless, maybe Monday, meatless day, yendi a habayin kwa. Kwa me kwa form kakra. Eti me uba me contest me election here from Kwesi Menken. Enye enonkwa me nkola abremu nyina Menken na me ye den. Ye kwa ye twi we can say kontomre. E wa haban mu ni aye den. Ni edi. Ni nyina those vegetables no. Ehu hia. Yasantoa. Gardeners. Ni nyina na fa he. Enti planting for food and jobs, planting for vegetables and jobs, planting for fruits and jobs. Said ye be bu na Ghana for be dey benya biedi. So we have to reorient our health service.
Yeah. The other thing I'm person may clarify because the conversation around premiums are you for NHIS, you know, say a form. I mean, there have been my interview, Mr. Arno. Dr. Arno, former CEO, my interview a Cowboy and Waba cell being a maintain income, and you realize say a topic run it through in say your premium payments na ewo from strategy near there is it with the national tariff we na work can wasem na
Obi me say me expect I have a different approach.
Okay.
Che Ghana ni bia system na good. Ghana ni bia to for insurance no. Through the NHIL. Okoto ade a oye den.
Yeah,
Obi, as we speak, we've been capped. Okay?
Yeah.
But the projected revenue within the capping is about 8 billion.
8 billion cities. Every year.
Okay. This year, no, just this year.
Okay.
The projected.
Okay.
In fact, the mid-year is showing say GRA are overperforming. So it means say
Okay. Okay.
Now out of the 8 billion no, yeah NHIS 6.8 any allocating billion ni allocating my
from parliament.
Okay. And yes kaketwa.
Okay.
So what I say.
Okay.
Ocean no premium no less than 3%.
Of the 6.8 billion.
Of the 6.8 billion. So it runs between 200 million. On our budget, it could be just one item. Oh, so me, it's insignificant. The only thing is, the solution is the digitalization. As long as you can identify everyone by the Ghana card, that everyone is paying, that you can collect directly or indirectly through what we are doing, why do you need the premium? You see, so these are the reforms. And again, it is not about the monies that are raised, but about the consistency in the monies being given to the NHI.
Scheme. Okay.
So now, my proposal is that let's reform the act in such a way that instead of the money going to the consolidated account, it will go directly to. We will have a lot of money. We will not need extra. Obviously, but again, you will see near the ama apomudin si achiba no. And two months as ano Ghana ni bia benya ho faso sa premium. See, Mamin Kasencho Obi. So premium no. Informal sector no. And the informal sector no, so your business people you won't go for the only way say the very poor omuna we have to cover them. No one can say by act no you cover omu. Again, with the Ghana card, we are integrating with Ministry of Gender. So they are the lead beneficiaries no. We capture them as indigents because at the end of the day, once you link again, it falls down on what? Digitalization. And see, media maybe me we say say Ghana ni bia want digitalization as biano tobo nesua. Because no in a development no ya den anko on ejinaso. Abrochita ye kokwa me unya dru airport pa ne wo ye den na wo touch it. Ubi bia digitalization. Ubi bia bia digitalization.
If I get you on this premium argument, I mean say as long as a Ghana ni bia betua the tax which includes contribution on NHIL, the system is okay.
Yeah, so because you see, it's the formalization because, like I said, it's a progressive tax system. Yeah. So, based on you will pay, 82.5% of who pay. Let's say 10,000. So I say you pay higher than me. ABM 8 million. So it's based on that, and that is the social insurance. Like you take care of the vulnerable through financial risk protection.
Okay.
So I say, until at the end of the day, every time the vulnerable is obviously protected. And I make sure say the major problem I away the informal sector. So if we are formalizing the system through Ghana card, I bet me identify will be a businessman or when your friend is saying or informal sector no now tasene dada o tuane de enti wo za ko gine ska bi wan ye in fact when say NDC forecast on be but won hu ye but me say MPP tena so na some ye see wa ade we ye be ye I'm telling you ye be ye because then
110 premium I say you know
we don't know why do you need it I'm showing you how you can do it so I'm showing you how you can that's the formula to doing it so why would you need it? You see, why would you need it? Again, nipa kro no babaye okwako tuasa premium no. Offer car free fee in acquire office. Look at the cost. But what to phone so? No wet me aye den. Wet me aye. Enya digitalization. And see, media me gidi say yentru yebo ni enhwe gaps na insurance ne mu no. Ni enya den. YNCC no. And me gidi say aban so etie. Me ni aban kasa otie. And some a make nyina matro ama aban ejitum because I don't never had a boy. And never boy as we can say on mine.
Very well. My main kind messages e be more the questions kakraba na afi yi ano MIA na yentwa so EKOSIISEN so na higher sempa 94.7 FM. Obi say Holali Agbemava. Also, your claim say Ghana has been in digital darkness for 60 years, cannot be true. Enti Menka Encho. We say Obi Broja Jemfi says Obi, didn't the government use health insurance money to pay for the ambulance spare parts contract? So I'm gonna say what?
Matiba, and you know, health insurance, you use health insurance can be to pay for any ambulance.
What have you done? Then am I?
Kwame, ambulance service. Our budget where DSU 15 million. Ghana cedis.
Ambulance service or budget or mumusika.
Of course, yes, because they cover emergency services. As I was talking to you, 15 million. Parliament are approving 15 million
for the year.
For the year, as we speak now, 5 million pen on my beji. That 34 million no. In him was any audio can be a boy memphiomo and yanokre.
It is a 34 million being po SCR.
It cannot be from NHI. It will not be from NHI. Why would it be from NHI? Because Parliament are approving budget which is 15 million for ambulance service. Then you go and overspend, overcock with them. It's
okay. And we say, Obi, please ask the CEO. His predecessor, Dr. Okoboy, started the construction of the National Claims Center close to the Lekma Hospital. If I may ask, when is the project going to be completed? We are aware of Bibisa.
I think so, even within allocation, once I end the budget, Parliament now approve my every time, no. But you see, to get a claim center, and I say that way, say every time, the kakra, I say a budget, so it's right.
Very well. We say, hi Obi. Do you know that your Ghana card number is also the same as your SNIT number now? Yes, Joseph. I know. I think SNIT for a year we be a man for Uber short code be an hour link. Sir, when yes, I know. Ma Yansha say Obi. Okay. And this one says, please, as a medical practitioner, I've been working with the health service, the Ghana Health Service since 2011, spending 9 years in BA. Never saw a patient with NHIS pay for surgeries. That's for CS and hernia repair, not even for pre-op medications.
You see, and again, Obi Maminka Samcho, you see, unse NHIS ne medical field nankasa specialty be a essence for munya time pana because at the end of the day, medium CEO, ABI no na mesu intimate me aka. But you see, you hear a lot of engagement with the public. Said the bear say o connect as a paracetamol and cover. We ground him what paracetamol what inti because of its speciality inti you hear a lot of advocacy. Inti no na essence and shop for where they in fact the benefit package ne crown be dey can say every day morning show ne crown esa mutimi fa no aka say oh NHIS cover way okwani aka say tuamentua in fact the CM no ka say a set call center to improve your services no so said the bear because you have to tackle the thing from the root and yes co-payment illegal payments so the problem will not solve so let's solve it from the system using digitalization now ya chase you
and nipa chrono or castle no your medical I think the message is very interesting. I'll say however he admits when who patient be out with NHIS card we treat for surgeries, CS and a hernia repair, not even for pre-op medications. Well, say, however, I got a transfer to Mother and Child Hospital, Kaswa, 3 months ago, and patient undergoing CS pay close to 400 Ghana cedis for pre-op medications and at least 1,500 Ghana cedis for the CS itself, knowing very well NHIS fully pay for the surgery. What is the scheme doing to curb this thing across the country?
See, Obi, ebia na maken Ghana ye suban ye nneoma bebre na ye suban. So what I say. Hwe wo de hwe scheme a etua between 180 million to 250 million every month. Every month oh, kwa me buy Obi me buy okay, me buy. Min tua ye kra me tua close to 1 billion. I'm telling you
in claims.
Me ba nanu ye. Me ba nanu me see me tria kra me close to 1 billion. And opa check it. Me di kan tria 170 million. Ena me tria 180 million. Ena me tria 2 months ema omo 300 million. Ena me tria 135. So 135 da me tria no. No mo see ya de ka bi you say 20 in fact hospitals almost say 2020 2021 in our claims were no this month so what I say we are still paying so utu aska we mu nyina na facilities no esa charge kwa menti ase obi enti yesu bind the ss bibia kwakoye to say oh the ya bind the bia na nye we ba bind so tua.
But facilities are you sad anyway because, for example, he goes further to say, sir, Obi, what is more disheartening is the exorbitant charges during ANC visit for pregnant women who are registered under the scheme. And from my experience of claims, no receipt is given for the extorted money for CS. 1,500 no. If you can get me an investigator or a journal, I can take you to those lying in wards to ascertain enough proof to my claim. Or say again, I emphasize all patients that visit the Mother and Child Hospital and Kaswa Polyclinic pay for the drugs given for hypertension and diabetes every 2 months when they visit. Yet NHIS pay for all such drugs. Ain't it, Doc? Well, you know, maybe it's gone beyond moral suasion. Say, yani amount for Kasa say when you sue buying the answer. Practically, what can the scheme do? You see, because facilities not are known. Mystery shopping.
You are right. In fact, you see, a systemic problem I see solving once and for all. So we have a three-pronged approach. First one is facilities. Almost say almost tariffs ne extra. Into the any tariffs in your day, including the service charges. No, yeah, no more. We are in a coalition, Ghana Health Service, CHAG, and we form a task force. Now, strengthen monitoring. Now, because yet me prosecuting Crofono, you operationalize that. Because we see we will stop co-payment, the illegal payment. You will see. The thing is, I saw do fear a 2 year. Na say no work hard on them. And you hwes enwoma amaye nyina na ye the systems ne ye den egu akwam. Said ye be ya ye nya kose ye bite a then ne ye den. Ne ye way. And to the to say the wakan me take it up menya facility no Kaswa Polyclinic. Me name nkola no be den e be kasa na ya hwehwem ne ehu said ye tie. But let me also say patient bia obenya we bia ne your call center as major call center number no answer ne everyone near dia tudwa so ye we a ye betimi ye investigating na say ehu say writer ye betimi akora juice guy den amount ye betimi ay den agi amount enti under no circumstances na 95% of diseases na ye cover no Ghana ne bia there be it is our practice, Nadia. It must stop.
But what it means is that say hospital edgy patient needs a car. They also in submitting almost claims.
Almost submitting.
Almost idea.
Want to say almost receipt because when him says or money receipt, that's ye be who I bear day. I bear ask them. Want there was test message. Those are some of the challenges. Way I can say. And again, Obi, you see, digitalization reduces fraud.
Yeah.
Until be out on digitalization biano on him say can anabia ede oye no ntimi nya de enye biem into the enyambotre nanka kranka ebe Ghana is being fixed. It may take some time.
Doc, sir, yes, said you kind in more contract no which is subsistent between more service providers no it was say the claims about process no be last about 3 months.
3 months.
In the day beyond as part of this scheme, no, you would have that 3 months lag.
Yes.
And no, so yeah, because the hospitals will still need money to run within 3 months.
Uno be your contract. You see, Entina is a insurance. Uno be your contract. Let's say or say submit to claims now within 3 months. Obey your claims now. And don't say charge away.
Illegal
payments. There be abroachable BI practices and in no claim system in our back say you will be up to date. There be any nanka claims that here. Any nanka claims that here. So what I say. That's the insurance concept. Entina say you can say way. In fact, normal claims and casacriano in terms of oka anyway say
sure.
We won't say audit almost processing claims as normal almost processing. And see that's the concept of insurance. And see I know the every time be I'm so be over catch us insurance then they cut 3 months we are bossing who because any juma every time any insurance system in the world will have that lapse. ABA a 1 year because of the contractual agreement and the frequency of way. But yeah, the 3 months.
3 months.
Even though hey at say promptly, but it's not possible.
Yeah.
So I'm giving you the technical aspect of what is really happening. And to hear normal high, they say, oh, insurance for the car. And you said to say the Americans say you tria up to April, near tria up to March. You knew be a car. See a tria to it. I just said
based on the contract.
Based on the contract, no. And those are concepts I say but again, complications. We won't say bisu more. Day banacrano, anya claims ni reject it anyhow because you need to making sure say
vetting claims
vetting claims no so ni nyina ye enioma enti provide education ma facilities how to submit correctly how to insurance dey obi adwuma kese
yeah it's true utie me na wo message 0548 443 523 0548 443 523 your WhatsApp number no me Dr. Aboagye DaCosta ono ye CEO of the National Health Insurance Authority and AD come a very interesting conversation here we say obi to curb the issue of these charges on CS, for example, it should be mandatory that before paying for claims of clients, contact of the said patients should be attached and their call centers must call the patient before processing payment. That would also be doable, even though it will take a lot more work, you know. But no so anke betimi aboa o.
The annual health check.
Yeah.
We're going to use a system with the coding system.
Sure.
On the CM no say. We are even trying to see say all facilities should have the fingerprint machines. We've started the pilot. So patient be you need to do your fingerprint. We will know. So systems were why way try to but just say afiansa na ye hyase enti it will take time kakra and to the moment time kakra me say insurance never fan into my perfra
very well. We say Obi I am Andrews, known as a Brim writer. The innovative approach of Dr. DaCosta Aboagye has led to the successful integration of digital systems, expansion of coverage and strengthening of stakeholder engagement. He has also championed initiatives such as the dialysis cost coverage, which has alleviated the financial burden on patients and families. Lastly, is a man with humility, and I pray that the good Lord grants him his heart desires. Where's the Obi? Although he, Dr. Aboagye DaCosta, was late to arrive, his presence is packed with significance and potential, similar to pregnancy that is overflowing with life and promise. The dialysis support free annual health checkups is a testament to his leadership and passion for the well-being of citizens. Aboagye DaCosta's legacies will forever be remembered. Oblite come edie and oblite thank you. Efie penny or say Dr. Aboagye DaCosta, a visionary leader transforming health care, and it's also then Dr. Aboagye DaCosta, the newly appointed CEO, embodies the perfect blend of professionalism, humility, and visionary leadership. His impact at the NHIA has been profound, even in this short span, and he enumerates some of the focus areas. Only ache sisia sign ebo abas in the fear penny eastern region in Koko specifically, not the way aba. Where's hi Obi? Please ask about the lab text being charged by hospitals. A poor Ghanaian cannot afford the test, and it's driving a lot of people from going to hospitals. In the lab, and that's how we lab test there. Because momo annual
you cover some of the
lab test.
You cover
okay.
Some. So you see, kwame ni nyina ne say you see, you need to fix the system. And this is what I'm saying is that let's fix the system, because at the end of the day, you see, let's be honest with ourselves. If you say me review me tariffs once a year, okay, let's say there's an escalating prices, the providers will also and they'll have no means than to it say buying and our parliament am I and the authority to review your prices
as and when
through
the automatic
price adjustment formula in line with maybe inflation. in line with prices of we say near fixed price of medicines, near fixed price of services.
And it claims now providers neka say iswasisiano
the tariffs no
the advance say oma para NHI akase for para the beton
one city.
Okay.
Because bear in mind that framework contract so then because almost sign a contract with that. And you want to mean so you then review because once a year. And you where COVID by no problem because at the end of the day prices actually went up. But we couldn't review it.
And the facilities will lose.
They will lose. And you solve that issue once and for all.
And you propose the way out is to implement the automatic price adjustment formula.
Yes, with a National Tariff Review Committee. Independent Tariff Review Committee that will review the prices with various stakeholders. And so, for example, say say inflation EKOSIISEN and ABI was 20 something, EKO 23. Then there will be a justification for the tariff review,
upward review.
Exactly. No more. All you have to bear in mind say budget in terms of claims the plus some percentage so all we have to do is say we will plus that as we if you are says
oh okay
yes if you are na wo ho enti ne nyina ye say ye benya sa amendments na wo we no luckily airline enti the airline ye wie ye dey call the minister or near minister dey call parliament some of these things ne nyina ye be cover den ewom ne ahwe said ye be near parliament say the baso a wonya den
so that's interesting. We say Obi, my national ID card date of birth is different from what I have on my national health insurance card. How do I merge the two? Please ask the CEO for me. That's
why is our date of birth they say digitalization don't mean have football age.
It's true. It's true. We say Obi, I'll be surprised the National Health Insurance boss in your studio does not have the relevant information on national health insurance to debunk the lies of some George. Also, the National Health Insurance law was passed under Kufuor when one Sylvester was the boss. My grandma had a yellow and blue card printed for her in 2008 to replace the laminated card. Executive Fredo Alejokuku, I think that we've gone past that particular debate. We say hello, Obi. Good evening. I'm honored to share a significant chapter from our family's journey. In 2018, my wife Segi delivered our beautiful twins at Sunyani SDA Hospital. It was a moment filled with immense joy and profound gratitude. I would like to take this opportunity to express my sincere appreciation to the Ghana National Health Insurance Scheme. Thanks for their support. We did not incur any out-of-pocket expenses at the hospital. Their dedication to providing comprehensive health coverage made a world of difference during this special time in our lives. It is through services like these that we are reminded of the value of community support and the importance of having accessible health care. I am deeply grateful to the assistance we received and for the exceptional care provided by the hospital staff. Thank you. Obemfo Ewusunyani. That sounds really good.
Yes, that's some good news.
Sunyani SDA Hospital. Okay, that's really cool. That's really cool. We say, Doc, you're doing well for Mother Ghana. Keep up the good work. Louise Mensah, Manchester chairman, and on the way are praying. Please tell Doc the world needs more leaders like him, so he should keep pushing forward and never give up on his mission to improve healthcare for all. Also, you are making a difference. Ohineba ewo Kumewu dadie ase. Kumewu should be your constituency, right?
Constituency.
Yeah. Kumewu dadie ase. Where's the hi Obi? Tell the CEO he cannot bite because they know the real situation. The monies are not being paid and on time as well. As you said, they need money to operate. I dare him to bite and you hear the real cancer. Kweku ewo Guildford in the United Kingdom and on the way Abba or say Muntimi Shada and punish facilities because Muntio.
I've told you say I say mean metna say anyway. So anyway.
That's true. We say Obi to eradicate the overbilling issues in the various health facilities. The scheme can open an inquiry office in all the health facilities, which will be manned every day by an officer of the NHIA. The presence of the officers in the health facilities alone will compel them to do the right thing. Ike Somwa Yeboa Ewa Lekma. But I don't say you have many officers stationed at the facilities.
First, ne cry no na ye for no cry ewo. I think that you see, so what he's trying to say is part of the grievance redress mechanism systems, which I believe say, you see, if we have so there's a call center obey away. But our facilities neswa they will tell you say so we be na fatu box fatu away say it improve transparency. So I agree with him. I think say going forward it will even create jobs anyway for people. I think that we should
like a scheme ninya officers in the various facilities
for say so unya NHIS who be na no I den wakone ho no I den
and they are not saying say charge you illegal you can go and report.
You can go and report. Oh, so those are some of the
I think it's something you should do.
I agree with him.
Kweku, I say Suhum Government Hospital. There are reports from some patients that they are being charged for surgeries, which is covered by the scheme. And you say, what will doc do about that? Any medium to send such concerns to? The doc would get us the call center. Okay, Mame Mobo. And there's the call center into a more short code and a more normal number will be to me. A fresh short code no AS 6447 6447. It is a 4-digit short code 6447. You can use that. And a number means 0544 446447. It is 0544 446447. Unya issues biya fa NHI ho a obetimi afre wako hospital na ya charge o sika ofi say illegal frɛ 0544 446447 0544 446447. Honorable Alexander Akwesi Akwa MP Achimda and a Deputy Minister of Health OT was Honorable, good evening to you wherever you are. Ma in this hard number be saying say me a patient they are charging me fra then what do I have to do?
Service 24 hours.
And me the hospital needing
all the hospital
charge or my charge
if you create Rebecca say a picture with we no never send so we need be so only phone now between the chat phone be direct you on what to do. I think so Kwame, you see me no to say do who am kakra, you see human being be our propensity to be bad.
Okay.
By the systems that you put in place.
Sure.
In a bit me ama human being or very bad and also on your bad.
Sure.
Me, I believe in systems. Okay, in Ghana though we have a system, I'm not saying we don't have a system. But we need an improved digital system that will curb some of the because even see some of the abrochoko baby you cannot even pay cash.
Yeah.
You can't pay cash, so cashless. With your card. Na eko.
So the card in suit my paper trail.
Paper trail.
You bet me akose ade na Jesus cano.
Abroach almost system no. So what I say. Medication you will pay for it. Some of the medications you pay for it. In fact, they call it prescription charge. So what I say. Me ye adwuma of pharmacy no. Oba ma obis omonje. Obeka jo say way a friend is saying they are not even allowed to take cash. And those are some of the things that media said the system we must put in place. It's me know can say e-currency.
Yes.
But me say digital in development. Me say be and in development now be brainer and on digitalization. I'm telling you, me who say microphobia na party be digital na ye me sre omunim di omuka. Enti na me say what digital darkness of sister we've been in digital darkness of 60 years. Now see any answer see home for so.
But I know be the message but I said that would be an unfair proposition to me. When you know say we've had incremental development as far as digitalization is concerned. The NDC will tell you say under them also put some infrastructure in place and I'm about to build it on.
But now what are we seeing? You see, Kwame, Mamingas Obi Mamingas you see ubet me start baby so what I say.
Yes.
Me mom dear me no dear me nyane say dear ban bi ya no me nka say nya den ubet me start baby to say be crown and your my me predecessor na wo hoda do ba bia me buy na my den me highlight say emano den ehu so what I say first no ye ko school no say na throw boss anyway in fact e bi da so ho na say me ne Dr. Baomia ko we Opokuwari school o Kumase ade a me ko me hu enkola ne books na e tablet so me wo pictures ni wo ho na me call where me who say teacher ni no ekuta pen bia oye. So you see, all that I'm saying is that it's now coming to light. So I say, so we were in darkness, now we are seeing it. And I've told you, say abrocho almost started yacho, but they say almost system no robotics, and I mean no say your STEM schools doing, so we will get there. And don't just say baby nyebi and yes America. All that I'm saying is say we were in digital darkness. Say the medium who light. I say baby a kono. A baby would de digitalization be dia grow biano. Let's just own him dia way then. Oh yeah.
Very well. Honorable Collins Adomaku Mensah, Deputy Energy Minister, say Uti Wachiaopa. Sanso and the Ashanti Regional Youth Organizer, Raphael. And so say ononso echiao papa EKOSIISEN no higher Sempa FM yene the CEO of the National Health Insurance Authority and AD and Dr. Aboagye DACOSTA. We are just about wrapping up on the show now. In the doc, in where do you see NHIA? The NHIA, the authority authority na juma ne se mo manage the NHIS and other private health insurance, schemes or system name. Inti mo major way the NHIS. Where do you see it in the next 5 years?
Okay.
So nyame ya domina uye CEO for that period.
Me da say. You see, me de bia me ka say ye model na ye practice no eye. Eye pa. Gaps kakra bi wom. Eno na ebi na ye try say be den, ye be address no. De me hu ne say is sustainable over time. Yes. Baby or why and share that and share pa. NHIS now we have to provide access.
Okay.
Now access no a year broad access to health facilities, access to infrastructure, access to in fact when you say be or crack or bobosia edebeye we say. Now I am thinking say if we bring some of these reforms, let's say wuska to say the make a discovery we must actually venture into purchasing of some of the equipments like dialysis machines for facilities to drive down the cost. It will help reducing the cost. No, see BP in some year what prevents us from buying BP machines for facilities
hospitals
to reduce our cost? What prevents us NHIS Yabeka say see maybe a prison hospital for the vulnerable population. So you see, I see the NHIS potentials, and I believe say we first have to reform the funding sources. Once we reform that, near the in fact another area investment. Okay, now let me tell you, drones deliver medicines to various places. Drones no, they are listed on the stock market. Why can't NHIS go so that we deflate it? You see, so those innovations are things that I believe that on the long term you have to look at it rather than we paying with. We can just So over time, I believe say some of these things will come to light. But I believe that the fundamental thing is to reform the funding sources, to make sure the acts, anyway, to say they make the GRA after validating the way saying there shouldn't be another bureaucracy of going to the consolidated fund. It should actually go to the NHIL account. Okay. The money should be there, used for its intended purpose. Yes, we should spend about 15% of our budget on health. How much are we spending? But you see, if we do the we will even increase it more than the 15%. So it's just those reforms in kakrano in a media
and then when you fix the tariff
we say no. We say NHIS very, very strong to say
Obi, please ask him, how do I know I am wrongly charged at a hospital? Because does it mean any amount taken at the hospital without receipt is illegal, I want to know, please. Of course, yeah, Jews can know amount receipt there. I'm in issue a illegal payment. You know, but for NHIS, I think what you would see, they say, if any ailment I would covered by NHIS. No, be Jews can that payment becomes illegal.
And then I say, I say, Yamagana for because a dorsum, 95% of the disease burden.
In Ghana,
Mukova, Yakova. The when it's a difficult task.
Okay.
But the essence and short for and say or takrade. Those are the things that we are exposing in Central for. Said in fact, your handbook of a normal cover, which is here and
yes.
Those are, in fact, say morning show. Now you can't politics. National issues. So what I said, those are the things I see a timid shapey. Then yes, will be a certain agenda or cost room. Oh, there be young bon qua, there be young focus.
Only one thing I may propose.
Catch them.
All papers a good name. Your friend a live presenter mentions.
Yes.
In the other may program now my year Eddie film. We can have an LPM a NHIA LPM. In the other be breaky. Nyarwana NHIS cover every day me bought 10.
Yes.
It is a every day me bought 10 every day me bought 10 na a seat na my saying restarted my boy be 3 months campaign.
I agree with you. I agree with you.
Remember me sales team the proposal and then we take it from there.
I agree with you.
So I think it will be a good way to start. A man who say okay, meaning say minya malaria me kwa NHIS cover.
Again there's one thing that I also want to see as a minor, we should also be prepared to put money in communication.
Of course.
Because at the end of the day, bibia say bia me o banche boni.
Yeah.
Let's say me man ton banche me meant me anye advert ama banche papa na me wono let's so obi me banche boni no ye beto de ne no enye na o ye advert no than way. But your budget all the communication ko sempa na e do atem. No, I'm being honest. Let me help promotion. Budget crowd the be advert ni way na problem. Minim Ministry of Information for minim more budget on communication. NHIS minim your budget on communication. But so per se at the end of the year dia any abino anyway nyina
I said the rule
any Ministry of Communication go here budget all the agencies who here communication budget to propel the agenda until ma politicians so nye dede bebre e won ho say bi agency ni bi wo we are make bi amamo mejitum because at the end of the day and also a sector we need to grow it.
Of course.
What I say,
of course. Remember, may put a proposal, okay, to every together, and then we take it from there. But Honorable Sampine, mayor, or something kind of Uhia Para. You better say, I think it's been good. I mean, a brand, I know about best trying. Not just yeah, Timia Magana for what the Kosovo or sector and so I say, Timia. We wish you very well.
Thank you.
Fantastic. And Dr. Aboagye DaCosta is CEO of the National Health Insurance Authority. Unim say, yeah, authority say National Lottery Authority.